The bill on your kitchen table right now has a 79% chance of containing charges you were never supposed to pay. Not because the hospital made a mistake, because this is how the system was designed. Who designed it? The same people who send you the bill. The same people who decide what your insurance covers. The same people who have been quietly collecting billions of dollars every single year from people who worked their entire lives and did absolutely everything right. Today, we object. Here is something the healthcare industry spends $700 million a year lobbying to make sure you never fully understand. Medical billing in America is not just complicated, it is deliberately complicated. A study published in the Journal of the American Medical Association found that 8 out of every 8 hospital bills in the United States contain at least one significant error, and the errors almost never go in your favor. How much are we talking? The average American household overpays $1,300 in incorrect medical charges every single year. Across the entire country, that number becomes $68 billion. $68 billion taken from working Americans, legally. And the reason it keeps happening year after year is not because hospitals are incompetent, it is because 98% of people who receive a wrong bill pay it without question. Are you in that 98%? By the end of this video, you won't be. I'm going to show you exactly how this system works, the 7 most common overcharges happening right now, and the exact words to use to legally fight back and win. And I want you to stay for number 4 on that list, because it is the one that most people pay immediately without realizing it is almost always completely illegal. To understand why your bill is wrong, you need to understand one thing that hospitals desperately do not want to become common knowledge. It is called the Chargemaster. Every hospital in America maintains a secret internal price list. It contains the price for every single item they can charge you for. An aspirin, $30. A pair of surgical gloves, $53. A blanket, $89. How much do those things actually cost? Cents. The Chargemaster price is not what hospitals expect to collect. Insurance companies negotiate it down. Medicare sets its own rates. But here's the critical part. If you don't have insurance, or if something slips through, or if the billing department makes an error, and they will, you get charged the Chargemaster price. The full, inflated, legally set by them, never negotiated number. And they send it to you on official letterhead, and they count on you thinking it is final. It is not final, not even close. Now, the 7 overcharges. And remember, I told you to watch for number 4. Overcharge number 1, facility fees. You walked into a clinic, you saw a doctor for 15 minutes, you received one bill from the doctor, and then, a few weeks later, a second bill from the facility itself. This is called a facility fee. It is legal, it is common, and it is almost never explained to you beforehand. Always ask before any appointment whether a facility fee applies. That one question can save you hundreds. Overcharge number 2, upcoding. Every medical procedure has a billing code. A simple office visit is a different code than a complex consultation. Upcoding means billing you for a more complex procedure than the one you actually received. A 2023 study found upcoding in 1 in 4 hospital bills reviewed. Request your itemized bill and compare the codes charged against what actually happened in your appointment. Overcharge number 3, duplicate billing. The same service billed twice on the same invoice. This happens more than you would believe, and it hides easily in long itemized bills because most people never read every line. Read every single line. Overcharge number 4. This is the one I told you about. Balance billing from out-of-network providers. You chose an in-network hospital. You did everything right. But one of the doctors who treated you, the anesthesiologist, the radiologist, the surgeon's assistant, was out-of-network. Did anyone tell you that before they treated you? Of course not. And now they're billing you the full out-of-network rate for a provider you didn't choose and couldn't have known about. Here's what they don't want you to know. The No Surprises Act, a federal law passed in 2022, makes this completely illegal in most circumstances. If you received a surprise out-of-network bill in the last 2 years, you may have the legal right to dispute it entirely. I'll show you exactly how in a moment. Overcharge number 5, phantom charges. Items billed that were never actually provided. Medications listed that you never received. Procedures documented that never happened. This is billing fraud. But because the system is designed to be confusing, it often goes undetected. The only defense is your own records. Keep a personal log of every treatment, every medication, every procedure during any hospital stay. Overcharge number 6, unbundling. Medicare and insurance companies require hospitals to bundle certain related procedures into one charge. When hospitals bill each component of a bundled procedure separately, that's called unbundling. It almost always results in a higher total charge than the bundled rate. Look for multiple line items from a single procedure. That's the red flag. And overcharge number 7, the readmission charge. If you're discharged and readmitted within 30 days for the same condition, hospitals are often required by law to treat this as a continuation of the same case at a lower rate. Many don't. They bill it as a brand new admission at full price. If this has happened to you, note that date range and save it for later in this video. Stop. Before I show you how to fight this, I need you to understand something. The exact word-for-word script. Not tips, not general advice. The precise language, the specific phrases that hospital billing departments are trained to respond to. The words that legally obligate them to review your bill. This is what the next 4 minutes contain. And at the end, I'm going to show you one real bill, $23,000, and what happened when someone used exactly what I just taught you. Let's get into it. Step 1. Request your itemized bill. Not the summary bill, not the statement balance, the full itemized bill. Every single charge, every code, every line item. This is your federal right under the hospital price transparency rule. They are legally required to provide it. Call the billing department and use these exact words. I would like to request my complete itemized statement, including all billing codes for my visit. Write that down. Step 2. Compare the codes. Every chart has a billing code. Go to cms.gov, the Centers for Medicare and Medicaid Services, and look up what each code actually represents. Compare it to what actually happened in your appointment. Discrepancies are your ammunition. Step 3. Write your dispute letter. A dispute letter does not need to be written by a lawyer. It needs 3 things: the specific charges you dispute, the specific reason for the dispute, and a request for written response within 30 days. That written response request is critical. It creates a paper trail that matters if you escalate later. Step 4. Apply for financial hardship. Every nonprofit hospital in America, and most are nonprofit, is legally required to offer financial assistance programs. This is not charity. This is a federal requirement tied to their tax-exempt status. Many patients who qualify never apply because nobody told them it existed. If your household income is below 400% of the federal poverty level, you likely qualify for significant reduction. Step 5. Negotiate the remainder. Hospitals would rather accept 60 cents on the dollar than send the bill to collections and receive nothing. Use this phrase. I would like to discuss a lump sum settlement for the remaining balance. Lump sum. Those 2 words change the entire negotiation. Now, the script. This is the exact sequence of what to say when you call the hospital billing department. Screenshot this, write it down. This works. When they answer, do not start with your name or account number. Start with this. I'm calling to request a formal review of my billing statement, and I believe there are coding errors on my account, and I'd like to speak to a billing supervisor. 3 things happened in that sentence. You use the word formal, which signals you know the process. You use the phrase coding errors, which signals specific knowledge, and you ask for a supervisor immediately, which removes the frontline agent who has no authority to help. When the supervisor comes on, you say this. I've reviewed my itemized statement and I'm identifying charges that appear inconsistent with the services I received. I'd like to formally dispute line items under my right to billing review. I'll need written confirmation of this dispute within 5 business days. Write down every name you speak to. Write down the time and date. These details become critical if you escalate to the CFPB or your state insurance commissioner. And finally, if they push back, if they tell you the bill is correct, you say this. I understand your position. I'll be filing a formal complaint with the Consumer Protection Bureau and my state's Department of Insurance while this dispute is pending. Please note that in my account. You will hear a different tone in their voice after that sentence, every time. Let me show you what this looks like in reality. A woman in Ohio, 47 years old, received a hospital bill after a 3-day stay for a cardiac event. The total, $23,400. She had insurance. The insurance paid their portion. This was what remained. She did what most people do. She panicked. She called the hospital and arranged the payment plan. Then she found a video like this one. She called back and requested her itemized bill. What she found, a facility fee she was never informed of, $1,800, a duplicate charge for an MRI, $3,200 billed twice, an out-of-network anesthesiology bill covered by the No Surprises Act, $4,100, $9,100 in charges she did not legally owe. She wrote the dispute letter, she used a phone script, she applied for financial hardship, and she negotiated the remainder. The final bill she paid? $3,200. From $23,400 to $3,200 in 4 months, using exactly what I just showed you. The system is designed to make you feel powerless. It is not designed to be impossible to fight. That is why this channel exists. Let me give you this fast. The 7 overcharges, facility fees, upcoding, duplicate billing, balance billing, phantom charges, unbundling, readmission charges. The 5 steps: request itemized bill, compare the codes, write the dispute letter, apply for hardship, negotiate the remainder, and the 2 phrases that change everything. I would like a formal billing review, and I'll be filing with the CFPB while this is pending. Save this video, you are going to need it. Next week on this channel, the federal law that makes your medical debt legally uncollectible, not reduced, uncollectible. 100 million Americans have medical debt right now, and most of them don't know this law exists. If this video gave you something real today, share it. Not for us, because someone you know has a bill on their kitchen table right now, and they think they have no choice but to pay it. They have a choice. Subscribe to The Objection. We'll be here every week with the information the system doesn't want you to have.